Dr. Hongwana, we spent, an estimated 1.2 billion rand on COVID ICUs, some of them now abandoned or incomplete or even underused, as the Daily Maverick reports.
I've seen the report. Yes, there is a facility in Kopanung that was supposed to have long been commissioned as an alternate building technology for COVID. Yes, it is not completed.
It is far from completed. It is far from completed. We spent over 200 million rand. Why is it not completed?
It is not completed. So there is a lot of engagement between the Department of Infrastructure Development with the stakeholders involved to come up with a way forward as to how that facility is going to be finalized. And now going to the facilities that were completed and utilized, although not to capacity. Remember, these facilities were planned when the first wave came, based on models that were presented, given the international crisis of COVID, to say you would need so many ICU beds and so on. So that was a plan to be ready and to mitigate in case those numbers, as it was then described internationally, whether in China or Italy or Spain or wherever. So South Africa needed to be ready for that.
Doctor, I must come in with respect. I mean, precisely because it was a crisis plan, having spent an amount, and I'll take the Kopanong example, of over 208 million rand, precisely because this was an emergency plan, you cannot now be telling me, because I keep raising issues, whether it was, as you say, just the bread issue, or whether it was medical waste suppliers, you keep putting these issues as though it's a little curveball over here, it's a little challenge over there. These are systemic issues that are crippling the functioning of your department. And even as we talk about these COVID hospitals, can you explain to me, please, why it is that one Dr. Sfiso Good Hope Maseko was dismissed from Chris Hani Baragwanath Academic Hospital for allegations of corruption and maladministration, was then put in charge of the infrastructure budget and build project? Can you explain that, please?
No, I can't. That's sub judice.
What do you mean it's sub judice?
It's sub judice.
Do you understand the sub judice rule?
I'm not going to engage on that. It's sub judice.
No, the sub judice.
No, I cannot.
The sub judice. Can I explain? The sub judice excuse is an excuse used by officials and people who don't want to account. The sub judice rule does not apply. You can explain. You are not going to tell me as a result of this interview you're going to influence the legal process. You're not.
Let's agree to disagree on this one. I am not going to say anything about it. Frankly, let me be very frank to you, Daddy Bingwa. I'm not going to say anything about it sub judice.
Dr. Freddie Hongwana, I think you haven't said very much about anything, but I appreciate your availability this morning. That's the Acting Deputy Director General for Hospital Services in Gauteng. You make up your own mind.
Current events, developing stories,
tough questions,
your voice making a difference.
This is Breakfast with Bongani Bingwa.